in pursuit of health and wisdom. Sapio with Buck Joffrey.
Speaking of people who don't really necessarily need psychedelics for psychiatric illness and that kind of thing, one of the things that's become really, really popular, I mean, I don't know if this was especially during COVID or whatnot, because I don't remember hearing much about it before, is microdosing with psilocybin, right? You want to start out maybe just kind of telling us what psilocybin is and, how it may be a little bit different from at least the experience, how it's different from ketamine?
Sure. Yeah, obviously I have a lot more experience with ketamine, but I do have some experience, a decent amount with psilocybin, more on my own exploratory side. And I've always
Right.
been a doctor, so then I would always, if I had other people, and I used to be a sitter for people when I was younger as well, and I always liked to doctor with them, so I would observe and even
Yeah.
talk to them. So I always was very interested. But so you got ketamine, which is in the anesthetic glutamate category, mainly dominating in that. And then you have the serotonergic psychedelics. So you have like the tryptamines like DMT and psilocybin, and then the lysergamides like LSD. So let's just head back to the psilocybin. Again, it gets ingest it, it gets converted to something called psilocin, and then that gets into the brain, and then it activates these serotonin receptors known as the 5-HT2A receptors. And again, there's still a lot of unknowns on here, because
Right,
obviously we can't
right.
just give people psilocybin and then chop their heads off and look them under a microscope.
Yeah,
We
yeah,
don't have that.
yeah,
I
yeah.
don't think IRB approval for that
Yeah.
one yet. But so we have to make a lot of speculations. But we noticed a lot of these 5-HT2A receptors in like the visual cortices and in the prefrontal areas, changing the functional connections in which they're relating to each other and all that stuff like that. So I think overall, there's still a lot to learn. And I think there's still a lot of speculation, but overall, there's this more serotonergic effect. And one can think about it this way. I really liked, someone had stated it this way, like serotonin is more of about being, the sense of being okay with what's going on right now in the here and now moment. Dopamine is more about becoming. What do I want to become? What are my goals? What are I going to? So think about now you have this substance that's really about serotonin and the sense of just being comfortable with the here and now.
Yeah.
And so you get this much more just sort of settled in experience where a kind of timeless realm in which, and there's a much more deeper activation of open-eyed sort of illusions and distortions in visual perception, perhaps seeing things like auras, trails, those kind of things, but also a felt sense of greater connection oftentimes with like nature and just feeling just more about, because oftentimes you're turning down a lot of the sort of the upper level sort of processes, and also there's this kind of network in our brain called the default mode network, which often when we're feeling a lot, often we get so self-absorbed in our own stuff, like, well, what am I got to do about this, or what am I going to do, or am I going to be better than this person, or the comparator to other things. And a lot of these psychedelics tend to reduce that default mode. So there's a less of a meanness there. What some people will sometimes call like, and if done, in a high enough amount, they got what some people might call like an ego death, where they feel like the sense of me has sort of disappeared. Yet you're here, but you're just not that what you thought you were, the identity, the sort of the story that you have of yourself. And
but with psilocybin, which these are also popularly known as like magic mushrooms, right? There's a difference between what people feel at the regular, what you call the macro doses, and what people are feeling in the microdosing realm. With the higher ones being more the psychedelic experience, but the lower ones are, you can be totally functional. And we should just say this is illegal, so it's important. But one of the things we talked about offline was the fact that, hey, in reality, people are doing this, so it's good to know about it. It's good to have some information on it rather than just buying a chocolate bar and going to it, right? So, first of all, I guess when you talked about those changes, maybe some of the serotonergic ones, maybe some of the visual ones, with the microdosing that's become so popular, what are people typically feeling?
Yeah, if you're microdosing, I mean, one of the things as a physician is if your patients are, and a lot of people are, as you say, that microdosing, it's like we're not to take on a kind of a judgmental, like, oh, that's illegal. You know, we want to explore as to,
Right.
why they're taking it, what is the
Right.
use of it. And oftentimes the most common things are for creativity because most of these psychedelics, they improve trait openness,
Mhm.
the mind's willingness to explore new
Yeah.
ideas, new terrains, and develop a multi-perspectival approach. And that by taking a multi-perspective and seeing things from these different angles allows for greater insight. And so it became very popular in like Silicon Valley,
Right.
where they really wanted to have it like there was a high pressure to create new
Yeah.
things. So I think that general openness from from this great from its effects is there. You're not getting or you shouldn't be getting the a lot of the visual. You shouldn't be getting any visual effects at the
At the
microdosing level.
microdosing
We're
level.
talking about usually about 10% is the typical number of what macrodose would be. 10% is usually the area of what we would consider a microdose, where shouldn't
So
be really
what
feeling
would that be? Just so
intoxicated at
people
all.
know, like, because obviously you're gonna get, there's these chocolate bars and they have like, maybe they'll have 100 milligrams per piece or something
Mm.
like that, or what would be considered a microdose?
I know it better actually from the terms like if you had like let's just say your standard mushrooms, and generally
Yeah.
3 to 4 grams of the whole mushroom itself is often considered a macrodose,
Okay.
and then about 10% of that, so about zero point 0.3, zero point 0.4
So
would
300
be.
milligrams.
Yeah, I don't know. I think actually it winds up being, I think it was like lower than that. I think it's like 40 or 50 milligrams of
Was that
actual.
right?
I
That's
think
really
so.
low. Yeah.
I think so for the macro. I think actually it's less than, and then 10% of that for the, actually, or I could be reversing. Actually, I think you're right. I think it's
Yeah.
actually the other way around. Maybe like
Yeah.
more like 500 and then maybe 50 again.
Yeah.
But yeah, and so when you're doing these like little micro doses, you're getting some more of the openness. You also get a greater sensitivity to your own body, and so it gives you, because a lot of times, like, all right, if you just started smoking
Uh-huh.
and you're smoking away, at first you're just coughing like crazy. Your body's like, it knows it's
Yeah.
toxic. But if I keep doing it, eventually the body will sort of, you dull down this sort of natural regurgitory function. You get this toxin out of my body. So it's dulling your natural feedback mechanisms, orienting you towards health.
Yeah.
So when you take these microdosing, it sort of starts to resensitize these feedback mechanisms.
Yeah.
And I think that's what underlies a lot of, say, now we're seeing benefits with people. They start eating better. They start, because when they eat the crappy thing, they can really feel, oh, wow, this is so they get much more higher level feedback, which then helps them to make better decisions. And then if they smoke, they're like, oh my God, I can feel all the smoke in my lungs.
Yeah.
Like, and
Yeah.
they're activating, or when they're drinking alcohol or whatever of those things. So I think that's one of the main areas that this sort of enhanced sensitivity as opposed to a hypersensitivity of what is healthy for the body and what is not, plus this increased openness and creativity, I think are the main things that we're seeing, and the benefits. And also like that openness also helps you to become more connected.
Right.
So you might notice that oftentimes that we keep yapping at ourselves, like even when you're talking to someone else and the other person's talking, and instead of listening to them, you're
Mhm.
going over what you might want to say the next moment.
How'd you know?
And yeah.
I'm just kidding. Right.
So, are you microdosing? No, I'm kidding. Here you go. No, I'm just kidding. So, and so when you're doing that, there's this mild disconnection, and you're
Right.
constantly this sort of a self-obsession. So by lowering that down just a little bit, you're now connecting a little bit more. So you
Yeah.
can see people, and you can see how that could help people's mood.
Yeah.
And then they're being more productive, and they're less sort of in this sort of discursive thinking. So that could be, I think, are one of the main reasons we see these potential benefits. There's also side effects to this as well.
Is there like a euphoria associated, or not euphoria, but like, a lot of people I know who microdose will talk about, they do it and the only thing that they're really feeling is just kind of happy,
Mhm.
just kind of happy.
Yeah.
Right. And so is there something about the microdosing that's maybe affecting the opioid receptors, or what's going on there?
Yeah, I'm not really sure. I mean, I know at full dosing, psilocybin does also impact glutamate receptors,
Yeah.
and I'm not sure exactly the mechanisms, or I'm sure the scientists know as well. I think the happy quality is probably related to when you're not, because most of when we are thinking about ourselves too much, you feel kind of down after a while because you're going to get into this comparator mode. And so when you're having less of this sort of default mode now, or less meanness overall, feeling I have to compare all the time, putting that pressure on yourself, that's going to feel like relief. And in that relief, that could be euphoric for some people, depending upon how much tension you had. If you release that a little bit, you can feel a lot happier. And I would imagine that that was creating a little more inflammation, a little more sort of like, which I think then activates a little bit more of a hypersensitivity reaction that's from that inflammation. But flipping that on its head, and then it's like all of a sudden you're holding this big barrel, and all of a sudden you're letting it go. You're like, "Ooh, that feels good." It's like being tense, tense, and you're getting a massage, and you're like, "Oh, that feels good." And you get like almost like goosebumps and little endorphins. So I think it probably is mediated to some degree, endorphin, maybe not directly, but through the other ways and how it makes you relate to the world and to people. That probably increases the endorphin responses.
And is there, there's psilocybin research for depression as well, right? I know that's not something that you
I've looked at it a little bit, though. Sure.
Right. So, does it look about the same as what you're seeing with ketamine? Does it look better?
It's very different because oftentimes they're just doing one session. I mean, it's an amazing thing. And actually, after learning about it a little bit more, I had a session a couple months ago, led a session in that regard, where I did it, because oftentimes when any of us have done magic mushrooms, we often will go to nature and do these kind of things and enjoy. But in the studies, they're very clear that they really emphasize having the mask on the whole time to really allow your non-conscious, your mind, to generate the visual imagery, so you're not getting stimulated by outside stimuli, that you're really going inside deeply, get that entheogen to know the God that's within oneself. And then there's usually two therapists usually male, female therapists that are sitting there. So you go into space, and then they have music that goes on, and this one gentleman, I'm forgetting the name, who, for Johns Hopkins, had created a playlist that's been used, and you can actually get it on Spotify or anything like that. And by listening to that music and having the full shutout of like visual information, and you're just going into that state, having done it was profoundly different than just going out. I mean, those other experiences were beautiful that I've had in the past, but that experience you could feel it was much deeper, more therapeutic. And then, I mean, the amount of, in my session, a lot of grief that came out was like, I thought I processed a lot of stuff, but that coming out, but then that's also held with another person. Because oftentimes when we're having these sort of like let goes of these past difficult patterns, your body's either going to let that go through laughing, crying, shaking spontaneous shouting, or like, you feel chills, like goosebumps on the body. So oftentimes, like grief is a very powerful release of these things, but grief on its own, without another person present who can hold that space, who's not judging you for grief. Hey, don't cry. Hey, aren't you're being in a crybaby? All these things that how our culture, sort of engendered how we relate to grief. Because I'll be quite honest, just as an aside, if we understood and our culture understood grief and we were raised to be okay with it, I'd probably have 80% less patience. And I say that with all sincerity. So I think those deeper experiences with music, the shutting out of the visual information, laying down, being literally body position makes a difference, because when you lay down, your locus coeruleus, the area of the norepinephrine, basically adrenaline for the brain, your arousal state, it starts to shut down. Just putting your head and tilting it back will reduce the arousal state in you, so you go more inwards. And I do that with my ketamine sessions. That I may give an injection. I give it IM. I may start off with a low dose and then keep them up. And we're talking, but when I want to send them deeper, I will then have the chair put them in a zero gravity position and work in that way, so that it facilitates it, and then put the mask on. But so going back to the psilocybin, I think those kind of like that set and setting is so important. And by doing so, they had results of like the antidepressant effects that are lasting like for over a year
with a single treatment.
Yeah, with a single treatment.
Wow. I guess one last question on psilocybin. which is
Can you give me some? I'm just kidding.
I don't have any, but you're supposed to be the psychiatrist, dude. An herbalist, right? So
It's the herbalist in me. I'm just
the
kidding.
herbalist. You're so again, knowing that people are microdosing, I guess we're not entirely sure what the microdose is, but somewhere between 50 and 300 milligrams or something like that. It's still not something you would take every day, right? Is it like there's some regimens that people have been
correct
like every third day or something like that?
There's two protocols that have been sort of like popularized, and one is the Fadiman Protocol. Basically, you would take the microdose and then 2 days off, take the microdose, 2 days off, that kind of thing, and you can repeat that. Again, some people will do that for 2 weeks and maybe take a week off after that, but there is, you're giving breath. You're trying to, because you're trying to use it as a kind of a stimulator, and then let the behaviors then really do the heavy lifting, but not taking every day after a while. Because one of the things about psychedelics in general is that the tolerance goes up very quickly. After if you take like a full dose of psilocybin, you take it day one, day two, by like day 3 or 4, you would have to take like a tremendous amount in order to actually have any effect at all. So tolerance builds very quickly. So usually there's days in between. So that's basically the Fadiman protocol.
The once every 3 days for like 2 weeks.
Yeah, 1 day on, 2 days off, 1 day on, 2 days off, and then
for like 2-3 weeks.
I think it's like 2 weeks, or sometimes maybe some people say up to a month, and then take a week or 2 off. There's different intervals and all that stuff.
Yeah.
And then the other one, which I prefer better, when I have tried some microdosing when I actually lived up in San Jose, because I was going to be working on. I knew I was going to face a lot of patients, and I'm one of those people that
you want to know
as long as it's safe and you're doing something, you have the sourcing is safe and everything, that I want to know from the other side. Just like a good psychotherapist should have gone through their own psychotherapy. I think when you're working in the psychedelic space and you're going to be guiding, you should know the lay of the land. Even in the micro land, even though it's subtle, you should understand. So I think you're just a much better physician in that case. So the other one is Paul Stamets. He's very famous for his for psilocybin mushrooms and mushrooms in general. But his protocol is, I believe it's you do it 4 days in a row, the microdosing, and then 3 days off. Okay. Which kind of fits nicer, because the other one doesn't really fit into a week very well.
Yeah,
it kind of skips it.
Yeah.
And what I like about it is that, because one of the side effects that a lot of people will get from psilocybin, because it's serotonergic, is stomach upset. And so oftentimes the first day they feel their stomach get a little queasy. That's a big one. And then, but if they're doing more of the Fadiman protocol, then they go off 2 days and they go back on. And they don't ever habituate a lot of times to it. But I found that people who have that more queasy quality, if they do the 4 days in a row, maybe dial back the dose a little bit, because some people they think they're microdosing, but then I'll take a little bit more, because they're still trying to get some sort of like obvious effect, but it's very subtle.
It's very subtle.
It's very subtle. And that's why oftentimes you'll hear from people who are self-reporting, like, I feel a little bit happier. But oftentimes people like that, they're not really bodily intelligent. They just don't have the awareness of their own body, the subtlety of their body, to be able to describe some of the other differences that may be there, but they're just not able to report to you subjectively.
So again, that's just Stamets?
Stamets, yeah, Stamets, Paul Stamets.
Well, people can look that up, but basically, again, 4 days on, like 3 days off, correct. 4 days on, 3 days off for like, I don't know. Most of these, it seems like they tell you about 3 to 4 weeks, correct. And then, off for a month, and then rinse and repeat as needed. Kind of, right?
Exactly. Yeah. And then in the Stamets protocol, which I do actually, having tried both protocols, and I actually, again, I think different protocols will speak to different people. And that's why I think they both are so popular. But he actually adds some supplements to it: lion's mane, vitamin B6, and blanking on it might be vitamin, and niacin as well, nicotinic acid. It's he first discovered from his friend who had some peripheral neuropathy, who was treating his peripheral neuropathy by microdosing and taking lion's mane and I believe B6 and nicotinic acid, B3, and that actually took away his pain while he was still using it. But I think he found then, and I agree, after taking it with the sort of adjunctive supplements, that it did seem to have an augmenting effect on there.
Or people
and balancing too.
Are those protocols for depression, or what are those protocols for? Just in general, like getting a change? Like, how did they not advertised, but how do they roll those out?
Yeah, I don't think anyone because they're not really because they can't advertise for that. I think they're more just being descriptive in their nature, and I think it was more. I mean, he shared the story like I just shared with you about the peripheral, issues and everything like that. I think it's just more of a improving the brain, improving the function, whether it's more like helping the mood a little bit more, supporting the idea of like say the nicotinic acid makes little sense because it actually activates it can actually bolster tryptophan, which could then bolster serotonin. It can act like a preloader. So when you're increasing serotonergic function through the microdosing, it makes sense that you might want to use B3 in that case. And then B6 is also involved in serotonergic production. So again, it comes back to the way how I use like ketamine or anything, because I usually often, like after a few sessions with a client, I'll just do the ketamine. But then once I get to know the person, their underlying, I'll start adding sometimes augmentation strategy, like supplements they take just before the session, ones that I might have afterwards. And just to relate that back to microdosing, when you're dealing with the patients, I'm going to just give them my expertise and guidance in that case, if you are to microdose. And oftentimes, patients have microdosed like the day before a ketamine session, or I just say don't do it the day of, in that regard, because we just have no idea what that might do. But I did notice, and these were just a handful of cases that there seemed to be an augmenting effect on it.
Oh, is that right?
Yeah, it often, and then subjectively, when people are on ketamine and they have the mask on, some will get some visuals in there, some people won't, but it seemed to really turn on that internal visualization process. And it seemed to kind of, some people will notice in ketamine kind of a pixelating effect, a little more of a synthetic quality. And then you're combining that with something that feels a little more natural. So they balance each other out a little bit in that regard. That's what people were describing to me as well. And it seemed to be that and they were getting just longer tails on the end, meaning they would get that sort of perfume of feeling goodness after the treatment seemed to elongate that. So I was very impressed by that. I can't wait till I can get to the point where we can potentially recommend that and put that connection, because I actually think microdosing, because of its safety profile, and as long as you're getting, your source is accurate, I think that's where it's at. Because I want to highlight just one other thing, though, with macrodosing on these psilocybin, because I know a lot of people are doing that now because it's a popular thing. I've treated 2 people with legitimate PTSD from a macrodose of psilocybin. I mean, meaning going months on end with nightmares, flashbacks, all that kind of stuff, because they were in not the appropriate setting, and they took a very powerful dose. And so neuroplasticity is not all positive. You can have negative neuroplasticity. Addiction is a good example of negative neuroplasticity. So when you're opening that openness and the neuroplasticity and all these components, that's why set and setting is so important. And I want to highlight that I don't recommend people doing this by themselves, especially if you have any trauma history or think you may have some trauma history, and also making sure the set and setting is appropriate, that you have someone who's there that's not intoxicated, that can be a supportive person if they're going to engage in that. Again, all these to really have that harm reduction approach and to potentially improve whatever benefits that person is seeking.
Fantastic, Dr. Mantz. This has been a fascinating conversation, and hopefully people are gonna learn something from this, and potentially even find something to relieve their own symptoms. So I appreciate you joining us.
No, I appreciate you having me here.
Yeah, and we will see you next time on Sapio with Buck Joffrey.